What's up, guys? They are Henry Musawi here again on Semana Doc. Today we are on it again, talking about emergency hormonal contraceptive pills. We are going to be able to understand what are these and why are they taken, how do they work, and when are they supposed to be taken. Yeah. So emergency contraceptive pills, hormonal for that matter, so basically pills that are taken to prevent pregnancy in females who have engaged in unprotected intercourse within a certain period of time. These hormones, or rather, these pills work in three main ways. The first one is they prevent uh, they prevent ovulation or even delay ovulation. Two, they slow down the movement of sperms and the female eggs along the fallopian tube. And the third one is they prevent implantation of an embryo if fertilization has already occurred, by making conditions within the uterus unfavorable for implantation. So those are the three ways in which emergency hormonal contraceptive pills work. Now, when should they be taken? Ideally, it has been generally known that emergency hormonal contraceptive pills should be taken within 72 hours. However, the Kenya National Guidelines provides for up to 120 hours. That is commensurate with 5 days. 120 hours is equivalent to 5 days. Yeah. So within 120 hours, they can be still effective. Key message here is the earlier they are taken, the more effective they are. So it's very key to understand the fact that the earlier you take emergency contraceptive pills, the earlier they work. What are some of the common types in Kenya that we have? Common types of emergency contraceptive pills. We have Postina 2, we have Traston 2, we have Level 2, we have Choice 72. Yeah, they are of course, among others. Not to advertise any. Again, there's little evidence to prove that one of them is more effective than the other. Yeah. So why should we take, or rather, why should one take emergency hormonal contraceptives? They basically help to prevent unwanted pregnancy, especially for one in unprotected sex that was not intended. For example, if someone has maybe experienced rape, they are usually given P2, or rather emergency pills, to prevent pregnancies. People who have been lured into sex without their consent, whether they have been drugged, forced, or even or rather threatened, they should also be given, or rather they are given emergency contraceptive pills to prevent pregnancy occurrence as part of post-rape care, post-rape care. Yeah. So what are the common side effects? We have several side effects depending again on an individual, but common ones include headache, nausea and vomiting, some mild abdominal pains or even cramping. They can also cause commonly irregular menstrual periods and of course irregular vaginal bleeding. Yeah. There's a question that has been asked several times. Is there any connection between P2 and ectopic pregnancies? And of course, how many emergency contraceptive pills should one take within a limited time, for example, a year? So we shall of course answer that in our next video. Otherwise, let's go twende pale AFCON, tuangalie tusupport timu zetu pale hivyo. Mimi kwa leo kwanza, mimi niko Cape Verde vibaya sana. Mauritania walitoa timu yangu Algeria, nikasikia vibaya. So leo niko Cape Verde. Twende nalo babas. Otherwise, of course, subscribe Semana Doc grow kwenye tuliachia. Of course, mnajua hiyo story, hatuwezi rudia. Yeah. Kaende sana. Ama ni ajoda. Peace.